we are very pleased today to be welcoming two of Kokua Mau's finest. Hope Young is the Advanced Care Planning Coordinator, and Susie Lee is a volunteer with our Let's Talk Story program. Hope and Susie were invited last summer to make a presentation in California about what's been happening with advanced care planning in Hawaii, and I realized that we hadn't had them do that presentation here so they could talk to all of you about what's going on. So that's what we're going to have today. So Susie and Hope have some slides. They'll tell some stories. People can ask questions either as we go along or at the end. Take it away, Hope and Susie.
Thank you.
Absolutely.
Again, what Jeanette mentioned to you folks is we actually did this on a nationwide platform for the California Coalition for Compassionate Care. They invited us to do this as one of their breakout rooms for their annual summit. And so thankfully, Susie was kind enough to join me. So you'll get the Hope and Susie show. But it's about our advanced care planning innovations in the community outreach, including faith and diverse communities. Now, as we present this to you, view it with the lens that we were talking to people on the mainland. So some of this might not necessarily be relevant to Hawaii people because you probably already know some of this, but we'd like to get your feedback as far as how we might adapt this or change this, or what your thoughts are for upcoming presentations should we do this in the future. So I'm going to briefly go through this because you are all already here with us here at Kokua Mau. Again, we are a 501c3 community benefit organization and we're statewide. We are not a state agency, although we have been here in Hawaii since 1999. Our members include many of you folks who are in the audience today, including health plans, hospitals, hospices, our long-term care organizations. We have churches, all these people within the aging network. And I get the joy of working with passionate volunteers across the state, including Susie Lee, which is one of our ambassadors. And we concentrate on the continuum of care. So advanced care planning, including post, palliative care, hospice care, and bereavement. And we like to say thank you to all our partners who have supported us over the years. We'd like to add more supporters and more pages. So if you are not yet a member, we invite you to become one. Our 3 areas of activity include people who may be facing serious illness, as well as their loved ones, so that they understand the decisions they may need to make and find resources as early as possible. And of course, we want to provide professional networking and training. So we want to make sure that people who are on the front line have the tools in order to have these conversations with their clients and patients. And we also do a little dabbling in the system with policy and legislation. So Kokua Mau is leading a movement that aims to make advanced care planning and open communication about care and support for those with serious illness and their loved ones, including end-of-life care, a cultural norm. We want to have these conversations earlier. We want to start people thinking about their future and their healthcare wishes while they're healthy. We don't want folks waiting until they've been handed an advance directive from their doctor because they hit an age. So just because you're a certain age doesn't mean that's when we want you to start. We want everyone over the age of 18 to be doing this type of work. And so I'm going to ask Susie to jump in here.
Okay, so beautiful Hawaii. Just to remind you in case you've forgotten, in Hawaii, it is common for multiple generations to live in the same house. People in Hawaii often have mixed ethnicities, approximately 1.4 million in the state, and residents of Hawaii are referred as Kama'aina, not Hawaiians. Unless you are Hawaiian, then you could say you're Hawaiian. And these are just some pretty scenes. I think that must be Waimea Canyon. I think that's Rabbit Island, and I don't know where the bottom picture is.
The bottom one is Waimea Bay.
Waimea Bay, okay. And then Olelo, just to let you have a little bit of a Hawaiian lesson while you're sitting there. So Hawaiian words have many meanings. Aloha, which I'm sure many of you have heard, is not only hello, it's goodbye, it's love, affection, kindness, compassion, and a loving sentiment. So you could say aloha and it can mean any of those things or all of those things. Ohana is family, kin, And more importantly, it does not need to be blood. You don't have to be related by blood to be ohana. And also hanai, malama, to care for, to tend to preserve, protect, and maintain. And kapuna, a grandparent, ancestor, or elder. And I was saying on this, when we were having this meeting, for once I was happy I was a kapuna. I could get into Costco early, you know, so I was happy to be a kapuna. Okay.
And so one of the ways that we're able to get this work done throughout the community is with our valuable ambassadors. I have the joy, again, working with all these ambassadors, and they are available and with me as volunteers. They do this from the kindness of their heart. They see the value in the work that we do. And our volunteers are across the state, but most of the ones that we get to work with are here in Honolulu. They help with health fairs and with these types of presentations out in the community. Of course, these are all pre-COVID pictures, but these are people that are very dear to my heart as far as our Kokua Mau ambassadors. So our approach to advanced care planning in the community is we like to go where people live, work, and pray. We want to go where people are already meeting rather than trying to establish meetings ourselves. Being that there are only 2 employed members of the Kokua Mau team, we don't necessarily have the resources to create these meetings, but what we do have is the ability to go where people are already meeting. So these places would include senior clubs, senior centers, places like churches and temples, other places of worship, retirement communities, retiree clubs. We've even had the chance to talk with certified financial planner organizations, the people who want to bring this information to their groups. These are some of our partners and collaborating associations, organizations. We've worked with all of these folks and more, but they have seen the value in what we're doing, and they want to make sure that this message of advanced care planning gets disseminated into the community. One of the interesting ones that we did was a presentation with the deaf community, and that was really great to see how involved they want to be. And while we communicate very differently, the sentiments are still the same. So we want to bring this to it as many people are willing to listen to us and hope to act upon this. Our tailored presentations really depend on the group. So we offer a 2-part presentation where the first session is really on the meaningful conversations. Talking about advanced care planning is kind of a hard and challenging things to do. But when you start to work with tools such as the Conversation Project starter kits and their guides, as well as Go Wish cards, it helps to ease the messaging and help people to really think about what matters most to them. So that's usually the first session. In our second session, we look at the actual documents to support them with their wishes, which would include the advance directive and the pulse. It's also our opportunity to introduce concepts of hospice care and what that is, and what palliative care is, and who that can benefit from. Each of these sessions are an hour each. And again, we custom tailor this so that it meets the needs of the group that we're speaking with. So we do have opportunities to do things with people who aren't available for 2 sessions. So those with time constraints, we really have developed a condensed 1-hour presentation. And that 1-hour presentation is really less emphasis on end of life and pulse, but it's more towards the advance directive, the conversations. And we've presented these condensed versions in different settings, including workplace wellness, the library presentations that we've done across the state, and with the certified financial planners. Also with in-services, we find that folks that are employees, they don't necessarily have a lot of time to do the 2-step process. So we sometimes need to condense it down to 1. When we are done, we want to make sure that we are having some sort of impact. So we actually send out an evaluation and we collect this information, and it's after the first session or a single session. But it also, what it does is it asks about action, if people are willing to take action and how comfortable they feel. So we're measuring quantitative, qualitative, and then their intent on taking action and feeling prepared. Our second session analysis, we talk more about the qualitative, the quantitative, and also what actions were taken between the two sessions, as well as what actions folks plan to take in the future, and how well they feel prepared to have these conversations. So to give you an idea, and notice it stops at 2019 because 2020 was the start of strangeness. So we did not include those numbers in this because we want to make sure that we give you a good idea of what it was like when we were out in the community. So in between 2017 and 2019, we did over 112 groups, which was over 2,100 attendees. 31 of those groups participated in the two-step presentations. 81 groups participated in single presentations. Again, the way that we are doing this is asking folks to invite us to their groups so that we're not having to organize this and they are able to promote this for their members. We do professional development, and we provide the free resources and tools for providers, the social workers, the case managers, the medical assistants, the nurses, chaplains, students, all of these folks who may be in the line of having an advanced care planning conversation with their clients or patients. We want to give them the tools that they need and the resources that they need so that they can develop their language so that they feel comfortable having these conversations. And the way that we do that is we encourage these folks attending professional development sessions to do their own first. It's really hard for people to ask somebody to put their wishes down on paper when you haven't really contemplated it for yourself. So our way to challenge them is to ask them to do their own first. And once they've done their own, take that opportunity as a chance to practice with their loved ones and get that going within their own family unit, within their own ohana. And the other thing that we wanted to ensure that folks recognize is to take age out of the whole conversation. You know, we hear oftentimes that folks don't start having these advanced care planning conversations until their patients or their clients reach a certain age. We want to discourage that. We want to make this something that we do for all healthy, independent, competent individuals over the age of 18. We want them to be able to do this across the board. And one of the simplest ways is to have an advance directive completed, which names their healthcare agent. So the professional development, we've gotten requests from various organizations. You can see a bunch of them up there. With our professional development over those 2 years, we had 75 presentations in person. And via webinars, we did this online with various organizations. They had us do echo presentations. Hawaii Public Health had us do some webinars. We've done it with schools. We've tried to reach as many organizations as possible. And included with the professional development is not just doing it for themselves, but we also wanted to include appropriate post use and advanced directives and emphasizing the conversation with skillful communication. We hope to have folks feeling comfortable and confident in these conversations when they're talking in a professional manner. So another thing that we were able to do is promote lunch and learns. And lunch and learns have been a really interesting development over the past couple of years. We have partnered with the state employees, unions, and benefit unions. And so that touches all the state workers here in the state of Hawaii. And so they have offered these lunch and learns for their employees. So these opportunities are to reach the people who are working. Oftentimes that's a sandwich generation. They're oftentimes their parents or caregivers to their parents or loved ones. And this number is just through 2019, reaching 600 employees. But in the last 2 years, between 2020 and 2021, that was an additional 1,000 employees that we were able to reach through these lunch and learn efforts. So with our advanced care planning during times of COVID, this is where it gets interesting because this is where we've had to pivot. The word has been pivot, right? How do we pivot and adapt so that we're no longer doing it in person, but we are still able to get that message out there? So we were able to do in 2020, believe it or not, remember everything shut down in March, right? So in 2020, by March, we had already done 12 in-person sessions. After that, we were able to do 9 via Zoom. And that was just the community presentations. The lunch and learns, they actually scheduled 7. Professional developments, again, in person was up until March. There were 6 done in person from January through March in 2020, and then 8 through Zoom. Our community collaborations, they went robust with 10 via Zoom. And it really seemed that during the first couple of months, there was kind of a hesitation about having these advanced care planning conversations. People weren't sure how folks would react to having these conversations. They were kind of concerned that folks would be fear. There would be fear about having these conversations, especially during COVID and the pandemic. So we adapted our messaging so that folks recognize that, you know, although there's so much uncertainty during the pandemic, during COVID, advanced care planning is one of the things that you can actually do to ensure your loved ones know what matters most to you. And that gave folks a feeling of control. And it really was helpful with messaging and folks recognizing the importance of advanced care planning. The presentations and the information remained the same, but we had to kind of shift as far as how we talk to the audience. We had to kind of adapt some of our exercises that we would normally do in person. But we wanted to remind folks that this is important information. And it's also important because of the way care was provided had changed during the pandemic. It was no longer simple to just go to the doctor's office. It was no longer simple to visit auntie in the hospital. So these are some of the things that we wanted to include with our advanced care planning during times of COVID. So I'm going to jump on this one and revisit our Olelo Hawaii for us, and just to remember what these meanings were and how we included this in our presentations. Again, aloha, like Susie said, we all pretty much know what that is. Hello, goodbye, love, affection, kindness. It's that loving sentiment. It's that caring that we have for one another. And of course, ohana does not necessarily mean blood relatives, but you could also include hanai, loved ones. And malama, when we are doing this type of work, we are really malama our ohana by caring for and tending to and maintaining, preserving. That's what we're doing with these messaging, with this work. We are doing this for each other and with each other. And oftentimes it's with a kupuna, which is our grandparents or elders. Oh, I jumped one. So some of the key takeaways that we used as far as messaging to invoke some sense of action for folks is to do it for your ohana so they don't have to guess what you want. Do it for your ohana, your loved ones, so they don't fight amongst each other. And I can say some of our ambassadors have told stories about loved ones not getting along and not agreeing in the ICU and having these arguments. So this is why we do it, so that your ohana don't fight amongst each other. And this is how we malama our kupuna and honor their wishes, by knowing what they want, or more specifically, what they don't want. And this is how we give it to them and how we're able to help and support them through times of illness or at the end of life. So when we say it's about living well, it's about living well all the way up until the time of death. It's really how we show our aloha for each other. So one of the exercises that we've had to kind of adapt and adopt is our icebreaker. Prior to COVID, we would do an icebreaker and we'd ask folks to turn to their neighbor and share an experience where they witnessed either a good death or a hard death. Now, when we were doing this out in the community, it was actually really interesting to see how people would just kind of give us this blank look like, you're not going to make me talk about this, are you? And we really encouraged them to turn to their neighbor. And yes, we're going to have a conversation. And this was one of the exercises that, one, it really broke the ice. But two, it also helped folks to recognize that this is a common thing. This happens to each and every one of us, where we experience someone's or witness someone's good death or hard death, and how we carry that with us. So we've learned that everyone has a story and stories build bridges. But because we weren't able to do this type of activity when we're in the Zoom rooms, we started doing a lot more storytelling. So I'm going to hand it off to Susie because she's got some great stories.
I'm going to share something most recent, and I didn't share this with the meeting that we had in June. I just came back from a celebration of life while the person is still alive. So I have a very close aunt that in Florida that helped me with my mom. She recently got diagnosed with stage 4 colon cancer with metastasis. She's 83 years old, and she has decided she was not going to do any treatment. So she is in hospice. So it all started that her daughter was taking a ride down to start placing. She has a handicapped daughter, adult child. So that was on its way. And then when I talked to my aunt the day after I was told, she says, "Oh no, Wendy told you." And I says, "Hey, you're talking, I understand, but I want to come and see you." And she says, "Well, that's not necessary." And when I told her I wasn't doing it for her, but I was doing it for me, she shut up. So in the process, her daughter and I started thinking, well, let's see if we can get a couple other people down there now while she's still relatively healthy and happy. And so it turned out that all her children, her grandchildren, and friends and family, up to 19 people, came together last Saturday. And it was like the best experience. She was so honored to see everybody and to have the opportunities for herself to say goodbye to everybody. It was not very morbid. She's a funny lady. We gave her a parasol from my son's store, a black parasol that she told a couple of years ago, "I'm going to be carrying this in my funeral. I want you to be carrying this." So when she walked into the party, she was singing "When the Saints Come Marching In," holding this umbrella. She was just a kill. And we had so much fun, and she was so moved. She says, "It's so nice that you're doing this now." But of course, you can't ask anybody to do that. We did it, and we had food and drink, and it was such a great time. So I'm pretty sure she's going to have a good death. She already has hospice involved. She has a good family support system. She's not in any pain now, but who knows what the future is going to bring. But it was such a nice thing to do. And I don't know, it would be nice if all of us kind of had that last hurrah, that last aloha till you see somebody. But it's so hard for me when I had to say goodbye to her, because this is really the last time I'm going to see her. I could talk to her on the phone, but oh my God, I try not to cry in front of her. And I just, and we just said goodbye and "I love you." And that was that. But it was like the best experience I ever had, just to share the joy of her life. It was just so special. So that's my good death story. And it's just so amazing to be a part of that. And I don't think, like my mother died unexpectedly, so I didn't have that final goodbye. So it's nice to have. So I'm keeping in the back of my head, if I think if I get a diagnosis that, it may come sooner than later, throw yourself a big party. She says it's so neat that I'm here at my own party. And I says, yeah, this is what it's all about. These are people who love you and want to say goodbye to you. So it was a very nice way to celebrate her life. First, she said it was the meeting of the Klan. Well, she's in Florida. We said, Auntie, if you say that they're thinking of the Ku Klux Klan, please don't say the meeting of the Klan. Then we said family reunion. Then we finally settled on the celebration of life. So it was a very, very nice time. So that's my story.
Susie has great stories, and I just enjoy when she actually shares them because they're so heartwarming. You can feel it. Oh, yes. And I think the biggest part about these stories that we share is the opportunity to just tell our audiences that we can relate to whatever's going on. We can relate to each other. We may not necessarily be able to relate to the exact same story, but we can relate to the emotions, the feelings, and the desire to make this a good situation for everyone involved. So We're going to move on to faith communities. I'll pull Susie in a little bit later.
Okay.
I might surprise her.
Okay, I'm paying attention.
Okay. Thanks, Susie, for sharing that story.
You're welcome.
So, okay. So when we worked with faith communities, we have actually worked with quite a few different faith communities, various different denominations, United Church of Christ, Buddhists, the Methodists, the Jewish, the Seventh-day Adventists, the Catholics, and even the Mormons. They have invited us to come and talk with their people. And it has been great to be able to go to these places where these conversations are not so scary, because it takes on a spiritual aspect. And it's part of the reason why we have faith, right? What happens to us. And this is how we go in there, and we are able to be in a place where folks feel comfortable amongst the other audience members. So we have statewide collaborations, and Hongpa Hongwanji is actually one of the ones that we worked with closely, as well as the Roman Catholic Church. Hongpa, prior to COVID, they were our spot to get together and meet for our Kokua Mau meetings. They have that great place up on the Pali, and we were fortunate to be able to go over there and see each other and share food, and hopefully we'll be able to get to that soon again. But these are some of the collaborations that we've done over the last couple of years. We find that members have somehow found us, and they are in the congregation, and they show their interest, and they invite Kokua Mau to work and bring these conversations to their congregations. Oftentimes what's happening is the people in the congregation are saying, hey, I saw this presentation from Kokua Mau, and I'd like to have it. I think it's important for our congregation to know about this. And they'll take it to leadership. So it's really important to get the buy-in from leadership so that they can incorporate sermons and hymns, various scripture passages, any stories, so that there is a context of why advanced care planning is important. We offer this presentation for the entire congregation. Sometimes they'll say, can you talk to our senior group or our ladies group? And we encourage them to invite everyone. We'd much rather have all of the people who are wanting to hear this information to come in and listen. And I think we did one at was it Methodist? It was great, because we did the first session and we had a whole bunch of people in the audience. And the second session, one of the ladies in the audience, she dragged her son to it. And she said, I'm going to have my son come and listen to this because I think it's important. And I think we need, as a family, to hear this message. So we really want to encourage inclusivity and have people bring their family members, bring their kupunam, even their older children. Some of them want to bring their younger children. Anybody who wants to hear the message, we're asking them to come. And again, it is regarded as a safe space. So folks are a little bit more comfortable with each other. Oftentimes they've known each other for years. And so they're at a level of familiarity where they're comfortable having these conversations amongst each other. Our first venture was with Reverend Rosemary Lloyd from the Conversation Project. She came out from the Conversation Project, which is based over in Boston. And she came and did a advanced care planning session with the Church of the Crossroads. And what was really cool, and Jeanette, feel free if you want to chime in because this is your church. It was a great opportunity. Rosemary Lloyd kind of did some of the sermons. And actually, no, I'm going to call you out, Jeanette. Why don't you tell us about this?
So, well, I'm not exactly sure what you want me to tell you.
What happened?
Because there were
tell me
so
what
many
happened.
good stories. Well, it was, what happened. I'm just thinking of, for instance, my friend Edith, who had been trying for a really long time to get her family, to get her ohana to come. And she said, oh, this Hawaiian family, they don't want to talk about this stuff. And she laid down the law and she said, you are coming to have this conversation. There's going to be free lunch and you're all supposed to come. So she's a little bit off screen and you can't see it. And boy, her family was scared. Some of them stood in the back and didn't sit down for a while. But anyway, Reverend Rosemary really got people talking. And I should have mentioned too, Rosemary met with the pastor, Pastor David Baumgart Turner, ahead of time, to talk about what's going to be in the sermon, what hymns are we playing, what scripture is being read. So like when Edith's family came and they had to, of course, attend the church service too, they were used to it. There were discussions, there were talks about love and compassion and all of those things, so that when people finally got together, and there is something about being in a room when you are forced to do something and you can't go anywhere, you can't just run out to the bathroom for 20 minutes. So it was a really great experience, and people really liked it. They liked that it, you know, one of the things that Hope also said, the fact that we come to you, so here's a place where people feel safe and all of that. So anyway, what else do you want me to say, Hope?
Hope and Jeanette, wasn't this the one that not many people signed up and we weren't expecting a lot of people?
Oh, yeah.
And then they just kept on coming. You know, we were all there, and then you said only a few people like signed up, 10 or 15, and I think every chair was taken. So I guess
that's right.
The sermon and everything helped, because they said, well, let's continue this discussion over at the meeting hall, you know? So that's what I remember of it, that, oh no, not many people are going to show up. And then all these people show up, which was great. It was
right.
Great.
I think it was 25 people had signed up and like 81 came. And for those, and it was during Lent. So those of you who aren't, you know, Christians, there is a story where Jesus takes a loaf of bread and feeds the masses. So we were making jokes that in fact the masses had been fed off of this because everyone had something to eat. And I think also, you're right, Susie, like you could see that in the service, it wasn't scary. You weren't going to be called on to do something, you know, really scary. And then everybody showed up. So yes, it's good to remember to be flexible and have extra snacks and chairs.
Thanks, Jeanette. So again, this was the first approach that we did at church in the faith communities, working with with Kahu David. Here we have him, Reverend Turner, but Kahu David, he worked closely with Reverend Rosemary, and they planned this, and it was such a big success. And so we took that model and we copied that as we moved along through the faith communities. So for Hongwanji, Jeanette was actually invited. Well, they invited both of us, didn't they? To come and talk to them about advanced care planning. And from that, it kind of grew. It grew throughout the various different temples. And for those of you who may not have ever come to our in-person Kokua Mau meetings, that picture on the left, the temple, that is where we would meet downstairs. Isn't that a beautiful setting, right? And then these other ones were different temples across the state. So we actually did wind up going to different islands to talk to different temples.
And Gail has her hand up, Hope.
Yes, Gail.
You have to unmute yourself, dear. We can't hear you yet.
Okay.
There we go. Go, Gail.
Yeah, I forgot that. Yes, since you were talking about Hompa Honganji, Jeanette and I shared, Jeanette talked about the Advanced Healthcare Directive. And I was able to share my story, you know, about one of the members who I did an Andy story, and Hope helped me put together the pictures, but unfortunately it didn't get put together for the presentation. But I just wanted to say that it really, it was very well received for me to share with other Buddhists about my story, my Andy story about when he was at the hospital and the doctors asked him, who, you know, can speak to you should you not be able to speak for yourself? And he said, my mother died, I have no one. And it took the doctor 3 days, persistence, to get Andy to give him my name and tell them that I was at the Mo'ilili Honganji. So the doctor called, and we called him back, and we got connected. But it's interesting that as I told Andy's story, that we were fortunate that we had another good friend, and we had the minister, Bert Sumikawa, who knew Andy very well, participate in his care. And when the doctor called and said, please come, I called the minister and said, I think this is the time. And he came, and I went through the process that the Buddhists go through. They put a red piece of paper, they put it on his chest. It's written Namo Amida Butsu, and then he chanted the chant through the glass. And for those people who are part of it, I think they really appreciated understanding what the minister goes through when the person is dying. And I was able to share with them what Reverend Burt did prior to his death, and it was very well received. But I did that really with a purpose to remind everyone that in the church, you have single women, single men, and I think Hope will tell you that as she goes through advanced healthcare directives, there are people who will say, I have no one. And I really wanted to use that opportunity to say, please step up and approach these people who you know do not have someone who might be close to them, and let them know that you care. I think it's an important message. That's it.
Thank you, Gail. And Gail is one of our ambassadors as well. So her being involved with the Buddhist community was great. Able to share these stories and relate with their people at a different level than I, as a non-Buddhist, would be able to do. So thank you, Gail, for sharing. We also worked with the Catholics, which was really interesting. It started when Jeanette was invited to a Catholic convocation to talk to all of the priests. How many were there? Like 140 or something like that? 140 priests statewide, and talking about advanced care planning and the reason for it. And Bishop invited her. And that was a great entry into talking to them more about this. Eva Andrade from Hawaii Family Forum actually facilitated all the dates and the vicariates and helped to develop a Catholic advance directive. So there is an actual advance directive that was created specifically with the Catholic framing. And that was their response to the Our Care, Our Choice Act that was being passed at the same period. They wanted to have some sort of response for their congregations. So this was how they kind of handled that. I was able to work with Eva and Father Mark Gantley. Joy Adao also joined us, and we did a grand tour of the islands, and we were able to talk to all these different places about advanced care planning. And what was really nice about this is when I came, I was only talking about the conversation. I wasn't talking about anything with the Catholic lens on it, but just the importance of how conversations can really facilitate getting folks what they want. And then we handed it off to Father Mark, who talked about the Catholic lens on end-of-life decision-making. And it really was interesting to hear the questions, because as a lawyer, he's the judicial vicar. He actually had some really great insight for folks who were thinking that at the end of life, they're not supposed to give up. But Father Mark put it very well so that folks understood that the end of life is something that everyone will one day be faced with. And the Catholic beliefs does not say that you have to try everything. It just means that you have to come to terms with their Catholic beliefs. And I thought it was a great opportunity to learn from them, because of course I'm not Catholic. And Joy was the nurse on board. So she was able to talk about these other concepts of palliative care and hospice. So it was a great collaboration in order to do this. So for the Catholics, we had 9 vicariates, 12 churches, 6 islands, over 1,000 people. It was a great, robust opportunity to talk to this audience. And Eva was there. I will tell you, they were such a fun group of people, and it was a great opportunity to talk to these people throughout the state. So some of the pearls, also known as momi, is that we were able to learn from is craft the presentation to address the needs of the audience. Really, a Buddhist audience and a Catholic audience, they're not necessarily the same, but my message at talking about advanced care planning, it stays the same. It really does. So depending on where you're at, depending on what you're doing, include the leadership so that they're able to be that leadership position, and we come with the additional information. Again, stories and storytelling are effective ways to convey the value of advanced care planning. And again, we're changing that age limit. We want to get everyone over the age of 18 doing their advanced care planning. And that really levels the playing field. It pushes our needle upstream. It gets us a little bit into the conversation earlier. When we're talking about doing the advanced care planning, especially with the younger demographics, we're encouraging them to start with an agent. Who would you name for that person? If the unexpected happened, who would you trust to speak for you? And they would know what you want, or perhaps what you would not want. That's the first section of the advance directive, that we're asking folks to name someone. And if they're not prepared to go on with the next section, which would be the equivalent of the living will, that's fine. At least they've named somebody to speak up on their behalf. We also encourage folks to use simple language. Oftentimes, as professionals, we might get into the weeds with certain CPR, DNR, acronyms, and all of these things that folks, sometimes they'll look at you and they'll nod politely that they think they know what you're talking about, but oftentimes they don't necessarily know what that is. Making simple interventions very understandable. When I talk about CPR, I try to explain in real life what it looks like. So I will ask folks in the audience to take their thumb and their finger and go about 3 inches. That is how far you need to push into the chest in order to be effective when you're attempting CPR. And that's kind of an eye-opening visual that folks actually, oh, wow, I didn't realize it was that hard. Because, when we see things on television, it's like, boom, 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 clear, we're done. Oh, look, they're going off golfing. So we want to make it really simple for folks to understand, using that simple language, giving some simple interventions and what that looks like, explaining what the nasogastral tube does. So when I explained that, my mom had one in, and it went up the nose, down the throat, and into the belly. When people hear what it is, it's very much more descriptive than if you say, do you want tube feeding? It's a little more understandable and relatable as far as what they are asking from the medical side. And finally, making sure you recognize the health literacy of the audience, and trying to keep it to the language where they can understand it and they can ask questions about it. I am not a nurse, so I don't attempt to say anything clinical about these things, which is why I use very basic language. I don't try to go into the details, and I do ask if I have a professional development session, I ask nurses to come with me so that they can answer that part of that. But for the public, I try to stick with very simple, basic language. The other thing that we found that's really helpful, and I have a few notaries in my audience today. Susie's one of them. Jeanette's one of them. We also have a couple of others that aren't in the audience right now. But we found that offering free notary services actually motivates people, and it gets them thinking, oh, I want to get my free notary. If it's here, it's ready. I want my free notary. So we advertise that ahead of time, saying that prior notary will be available. And for folks who want to finish their advanced directive, we'll stick around. we'll stick around until everybody's been notarized and we get that stamp done for them. Want to leave you with this quote. Modern medicine has yet to make even one person immortal. So therefore, at some point, more treatment does not equal better care. And of course, that's Dr. Ira Byock. And Susie, did you want to add anything before we sign off?
I don't think so. What a lot of times when we're talking, we may not get the young people in our audience, but a lot of them have grandchildren. So sometimes we say, if your grandson was out surfing and he got knocked unconscious or he was paralyzed, and, he has to have somebody, he needs to talk about this and say what he would want to have done, because the parents may do everything in their power to keep him alive. If he can't surf anymore, it should be his choice, not the parents' choice. And it will default to the parents because, they don't have anybody else written down. But I think, and we usually use surfing, mopeds, or just, driving in a car even, so my daughters have done theirs finally. They're in their 30s, but finally that was one of the gifts they gave me, is that they did advanced directives, Yeah, no, I think that's it. I think everything's fine. But one nice thing to know, I saw my aunt's pulse on the refrigerator, which, obviously she's in hospice, so it was there. So I thought that was kind of neat, that hers is on the fridge and she's all ready, she won't be alone. One of her children will be there, not by her side every minute, but they're very close by. Okay.
Cool. So just a reminder, we have these all free to download. We have the translations available in 10 different languages. I believe we will be working on a few new languages hopefully in the near future. To add Chuukese and maybe a couple of others to this list of translations that we have. And here is our contact information. We appreciate you coming in and tuning in and hearing all the great things that we've been doing over the past couple of years. Now we've had to pivot, and thank you, Susie and Gail and Jeanette for sharing your stories and helping with this presentation. So I'm going to stop sharing. And we will go ahead and open it up for questions, comments, anybody else. And I think I saw something in here that someone wanted the slides. I'm happy to share them.
Well, I had a question while people are collecting themselves. Thank you, Hope and Susie. Fabulous job. Thanks, Gail, for sharing. I'm also looking at some other parts of the Speakers Bureau. If people have other stories like you, Pat, to share, please do. You had mentioned that there was community presentations in the time of COVID. Who are the groups that have been able to pivot to do Zoom? Because I remember certainly at the beginning that was not happening. But then we've all learned many things. So who was that? What kind of groups were those?
So we had a bunch of caregiver support groups. Project Donna was the first one, and it was actually really fun because Project Donna, I had asked them if her audience was comfortable. So Maria Morales is the coordinator for Project Donna, their caregiver support group. I asked her, are your people comfortable with the Zoom platform? Because that was kind of the reluctance that we were seeing people having, that they weren't sure about Zoom. And actually they had met twice before me coming into the situation. And she's like, oh, they're pros already. It's like, great. So that was the first one. And then it just kind of kept going. We had the retirees from the HSTA, and they asked us to come in. And actually they asked since then for 3 additional training sessions because they wanted to make sure that everybody could possibly get in there. We had some other ladies clubs that wanted to do it. There was a Chinese ladies club and they wanted to get it. And it seemed once folks were comfortable with the Zoom platform, it changed that folks were like, yeah, come on and talk to us. I think Zoom has been a kind of a really a blessing in disguise because, you know, we didn't have the opportunity to talk to all of the people but when they're homebound and they have a computer in front of them, then we're actually able to reach even more people. So what I noticed is that some of these groups were larger than what would have been if had been in person. So
one of the groups, Jeanette, was the Kidney Foundation, the Hawaii Kidney Foundation. I've done a couple presentations about palliative care. And then, of course, I've done some for kidney care and things like that. But it was pretty well received. And there's a couple other group. Well, I think they also hook up with some other senior citizen groups. But yeah, once these people got hooked on Zoom, you know, like probably their grandkids came over and told them what to do. They were quite well. I mean, they knew how to answer questions and to mute themselves. And so I think like Gail, Hope was saying, it's kind of nice. They feel empowered that they've learned some new technology, you know. Me too. You know, I wasn't that good at it either. So yeah.
I think we've all learned a lot about Zoom. So,
Yeah.
And, you know, and here, like, we get to have Amy Hamane at our meeting, and people from all over the islands are able to call in. So I think moving forward, our world will look different. If we can look at it in a positive.
Mm-hmm.
Great. Are there any questions or comments? Anything people are wondering about? I'm really interested in case people have suggestions for trainings that they'd like to see. Anita has her hand up.
I have a question about those surveys that you took between after your first and your second sessions about readiness to complete the advanced care directive. Are you tracking that data? Are you keeping that somewhere compiled?
So we were doing it a lot for in-person. When it went to Zoom, it was a little bit harder to shift. So we've started doing that again with Google Forms, because it's a little bit harder to get those forms back. We started doing SurveyMonkey and with the Google Forms to get some feedback. And it's been pretty much kind of the same responses as in person. But yes, we are tracking them. We are seeing that folks doing the 2-part session seem to be more prepared to take action. We've also found that folks who are doing the 2-part session took some action between the first and second one. So when we're doing the single ones, it's a little bit harder to gauge it because it's one and done. And so possibly we can go back and try it again, maybe in a month, and see what people have done. But with the 2-part session, we were actually able to see that, yes, they are either more prepared and comfortable, or they're taking action, or having the conversation. To us, having the conversation is action, right? So having the conversation, talking to their loved ones, talking with their doctors, completing the documents. These are all action items that we're tracking, and people are doing things between the first and sessions.
Did you do a similar survey for when you did the trainings for professionals?
The professionals, it was a little bit harder to gather the information because they're so pressed for time. So we did get some back, but it usually was not in the same volume as the community presentations. So maybe we've done 100 at HMSA and maybe got 15 back. So it wasn't the same type of response.
Okay, because I've informally surveyed our physicians that we meet with, and in the years ago when we first started it, it was a very low number would admit to having an advanced healthcare directive completed, and I was like, how can you talk to your patients when you don't even have one?
Exactly.
So, yeah. So, but yes, but at least now I'm pretty confident that there's more, because last time I've asked them, there was more and more of them have completed that. So
I'm happy to share the surveys with you, and you can see if there's any questions that you might want to adapt for your providers.
Terrific, thanks. And I think they'll be happy to know that you're out there doing this for them, because that's one of their complaints is that conversation with the patient takes up too much time. They only have 15 minutes with each patient, and they really don't have the time to sit down and talk to a patient and answer their questions about what's the details of the advance of completing that form.
And that's really important to recognize, because when they're talking to their doctors, oftentimes it's very specific to their own health needs, which can be even more time consuming than just the conversation on the advance directive. So what I encourage folks in the audience to do is, if they're talking about they want to talk to their provider, I encourage them on their next wellness visit to schedule the advanced care planning back to back, so they have that additional time. So they're doing the wellness visit and the additional ACP visit, so that doctor can bill for both. And folks recognize that, that's a better opportunity for them to go deeper. But it can be a challenge, and I can only imagine docs trying to have that conversation.
Yeah, this actually is one of the fundamental, Hope and I talk about this, like this is a fundamental problem, because my example is, like, we don't say to people, oh, lose 40 pounds, here's a handout, or you got to stop smoking, here's a handout. Like, it is a complicated thing that takes time and input and all of that. But somehow advanced care planning has fallen into the check the box category. So I think that it's really important that we recognize how much time it takes. It takes this thinking. People may be shocked. They have to go ask somebody if they want to be their agent. We also have all of these stories of one of the actions, Anita, that people can take is to find the advance directive that you think you have. Because people find, the people they named are dead, or the ex-wife, that was a good ex-husband, that was a good one. Like, it was so old that the ex-husband was their agent. So, there's a bunch of things that people could do, but it's not going to get taken care of in 5 minutes. So that's actually also one of the things that our member organizations like about Kokua Mau, is that we are starting these conversations, hopefully, breaking the ice, getting these things going before somebody actually ends up in a physician's office and is being asked for the documents. So that's also why we like 2 sessions, because one session, I don't know how many people have politely nodded and said, of course I'm going to do this, and sure, and Hope is such a great presenter, and I laughed with Susie, and did they do it? We don't know. And then my friends admit, I have one of my friends, he says he has 3 advance directives in his car because he's been to 3 presentations, and that's where they are. They're filed in the car, not completed, but he loved the presentation. So the last mile is definitely one of those challenges, how we get there. And I see Michelle Cantillo has come. Yay, Michelle. Michelle is one of the community's fabulous advanced care planning champions through her work at Hawaii Pacific Health.
Yeah, sorry, I just finished off another meeting with medical records, making sure to scan all the documents all correctly. But we had to upgrade with our electronic medical records, and it was showing us so many multiple documents of advanced directives and polls, and everybody was complaining. So we had to clean up the process. So I was like, good opportunity to let them be my quality and clean up the documents before they scan it in the medical record. So sorry I missed it, but I know you guys did awesome. Hope
we recorded it. Yeah.
Yes.
Absolutely. So any more questions? I would love it if Amy Hamane could say something about the work.
Rachel had a question.
Rachel has her hand up. Sorry, Rachel, I missed it. Go ahead, Rachel.
I Hope mentioned doing a back-to-back appointment plan with your Medicare wellness visit. Is there an official category within most insurance plans where they recognize an advanced care planning appointment as such?
It is a Medicare benefit.
Oh, really?
Yes.
Mm-hmm. Yeah,
oh, cool.
And there's a code you can use in the fee-for-service world to bill, and also, Michelle, you want to take that?
Yes, you can. We do it in an annual wellness visit, which is 60 minutes. There's ACP that can be built into that. And then there's a separate, like Jeanette was saying, code you can use for Medicare, even if you're not a Medicare patient. But the advanced care planning session has to be separate from your physical assessment and medical. It's got to be a total of, 16 minutes and things like that. So very specific. Yeah. But yes, the answer is yes.
Yep. And actually, Hope and I are always a little shocked, but Hawaii is leading the nation in advanced care planning. Yay us. Part of the thing that we're always shocked about is that what they can measure is the fee-for-service world, so not the Medicare Advantage world, fee-for-service. And actually, a couple of years ago, people contacted us because we were so fabulous at 7% of the Medicare folks in fee-for-service had advanced directives. And I thought they were going to say, oh my God, why is it so terrible? But we were like twice as good as any other state. I'm not sure where that stands now, but I thought that was a very sad thing. But that's not the Medicare Advantage, and the wellness visits are different. So it's not directly straightforward, but we like to think that we're part of this solution, making advanced care planning more of the norm. Okay. All right, Amy, would you like to just give a brief description of what you guys are doing with Community First in Hilo?
Well, first of all, I want to thank you for having this session, because I'm always wanting to know more about the different things that you folks are doing and how we might be able to adapt it here in Hilo. I did zoom in on the Hongwanji presentation, and I want you to know that Reverend Blaine Higa from the Kona Hongwanji has agreed to do an in-person workshop for us, to host one in August of 2022. And so we're really pleased with that. What we're doing is we're doing Zoom workshops and simultaneously doing in-person. And we've done this in Kona and Waimea, and we'll be doing it in Hilo. And so at the same time that we're Zooming, we have an audience, which unfortunately we have to severely limit because of COVID. And they're watching our Zoom presentation, and they're having all of the same materials that we provide to the Zoom participants. So I believe that that's the way we're going to do it in the future, that we can reach more people, especially on our island where we're so big that everything is so far apart. It's hard for us to go out to these outlying areas, but with Zoom, we can reach them. So thank you for all your ideas. Hope, I wanted to ask you about your lunch and learn sessions. I'm assuming that they can't be very long because it's during their lunch hour. And what do you cover in that short period of time?
So for our lunch and learns, the main ones have been done with UTF. So that's the benefit organization for the state workers, right? They've given us 45 minutes. And so in that 45 minutes, we're talking about the Conversation Project Starter Kit, how to have these conversations, how to really develop your language and think about what matters most. And then we go into the Advanced Directive and how to complete the Advanced Directive with regards to your wishes. And at the very last, maybe 7 or 8 minutes, I will go really quickly into the post. I don't go into depth as far as what it is or who needs one. I say who needs one, but not into the 4 different questions, the 4 different sections. I just briefly brush upon that. And then I touch briefly on palliative care and hospice and who needs palliative care and when hospice comes involved. So depending on if there's a lot of conversation during the first half of it, it kind of determines how much I'm able to squeeze in at the very back end. And with the UTF, because they actually have Kaiser members and HMSA members, they've asked to include 5 minutes for each of their service representatives to talk more about their advanced care planning benefits. So we're in and out of there within 50 minutes tops, usually. And then of course, I offer the opportunity to have more in-depth sessions if they'd like to go further into this.
Okay, thank you.
Yeah, you're welcome.
Okay. Anybody else involved with advanced care planning have a story they want or need to tell? I really appreciate.
Gail, I know I didn't have your slides available for you. Would you like to do your 5 minutes on Andy's story?
You have to unmute yourself. You don't look happy about that idea.
You don't have to. It's okay. I'm just like,
I was confused. Did you want me to tell my Andy story?
Would you like to?
Sure. If what time is it? Do we have time? Sure.
Why not?
Okay.
Okay.
Here you go, Gail. All you.
Okay. This is my friend Andy and my friend Anne and myself. And in June, we celebrated Andy's birthday. Next slide. Shortly after that, Andy ended up at Tripler in the intensive care unit. And as I had mentioned earlier, the doctor asked Andy, do you have someone who can speak for you? And Andy said, my mother died. I have no one. Fortunately, the doctor persisted 2 more days. And finally, on the 3rd day, Andy gave them my name and said I was at the Mo'iliili Honganji. So I called, the secretary called the minister, and I called our friend Anne, and the 3 of us went up to Tripler. And I got, through the social worker, I was able to get power of attorney for Andy. So Anne, our other friend, went back home that day, and she put together this poster that you see. And the very next day, we went up to the ICU, gave it to the nurse, and because he was in isolation, gave it to Andy to see the flag. And she said, when Andy saw this poster, he had tears in his eyes. And the nurse said, and I had tears in my eyes too. That night, Andy seemed to get a little better. But as the days went by, he continued to slip. And finally, when the doctor called me, I realized that what the doctor was going to say. So I called the minister, and he and I went up to Tripler, and he went through what was going on. And Andy, when he first, yelled when we were getting power of attorney, he said very loudly, I do not want to be a vegetable. That's the only instruction I ever got from him. So I talked with the doctor, and we decided to let him go. So we made him a no code. And so the Reverend, as I had mentioned earlier, I shared with the Buddhist congregation, because they always want to know about, what happens. So he put this, he instructed the nurse to put this red piece of paper that said Namo Amida Butsu on his chest. And through the glass, recited the chant we call Sambutsuge. That night, Andy died. So what I wanted to share with the next slide, please. Here, Andy is a veteran, and he had, and the next slide, please. And he was very active in our church, and he was our Santa Claus. So it's not as if he was someone who was not active in the church. He was very active in the church. And yet we never had this kind of conversation with him. Next slide.
Oh, we're upside down. Sorry.
Oh, that's okay. This is the Moilele Honganji. We had his services up at Punch Bowl. And the next slide, hopefully that one is right side up.
Yep.
Yes. And this is what we put for Andy. And please note, he has a Buddhist wheel, and we put as a reference, put cherished by friends, because there are so many of us who dearly loved him. And I guess he did not realize that. Next slide, please. So this is Andy with his I love you sign. He would be in front of the state capitol. And I use this to remind people at the church that you probably have Andys at your church and may not realize how important it is to have this conversation with them and tell them that you care about them, and please step up and offer your friendship and careness, and hopefully they will have your name on their power of attorney or just advanced healthcare directive. So that's my story.
Thanks, Gail.
Thank you, Gail, and thank you, Hope, for thinking of that. That's a wonderful story. It's, you know, we all know this, how important stories are for telling, for getting the information across. So thank you very much. That was very moving.